Welcome to our live stream. I'm Dr. Deuk Majan. I'm here with my team at Deuk Spine Institute. Our patient comes to us from Philadelphia, and I met her through a telemed. She is complaining about horrible pain here that spreads to the right side. Now, she has a very interesting story because she has a herniated disc at T3-T4. It's on the MRI. It's off to the right side. That's what we're going to fix today. But before she found Deuk Spine, somebody else got to her. You guys see this incision here?
Yes, we do.
It starts here. It goes all the way to here. You guys see it really good?
Yes, we do.
All right, I'm going to mark it with the pen. That is a scar from surgery. She had this done at the Rothman Institute, the top spine center in the United States and one of the top in the world. Recognized, Rothman Institute. 7 inches. Do you know why they did this surgery? They did it to cut her muscle out of her spine because her muscle was hurting her. Do you know why her muscle was hurting her? Her herniated disc was causing pain, which then caused her muscle to spasm. All they had to do was fix the herniated disc. But instead, they took the entire muscle out here. And now she has a defect. There's no muscle. There's muscle on the other side, but no muscle here. This is the wrong thing to do, folks. If you're having muscle spasms, it's due to a joint problem, not a muscle problem. Rothman told her, we can't fix your herniated disc, but we can cut your muscle out. She was so desperate, she went for it. All right. Let's get started. So we're going to perform a T3-T4 Deuk laser disc repair. We're going to go in and try to eliminate the pain from that disc. I can see T1, 2, 3, 4. I'm going to be first identifying the levels we're treating. Go ahead. More north. Shot. And shot. So that's going to be T1 pedicle right, just below, right there. Shot. So right there, she's got an artificial disc in her neck. You guys see it?
Yes, we do.
So another surgery that I think she should not have had, but that's okay. She had it. A lot of people get surgery they shouldn't have. All right. So T1, 2, 3, 4, shot. Too low. So right here, shot. All right, right about here. This is where we need to go. I'm going to put some numbing medicine to make it more comfortable. She's sleeping. A little bit of numbing medicine. If you have questions, feel free to ask me. I'm going to do my best to teach while I'm doing the surgery. But basically, what we're going to do is we're going to go into the disc using a transforaminal approach. I'm using a needle to get there. It's a special needle called a spinal needle. It's designed to do exactly what we're doing here. Numb them. Shot. All right. 1, 2, 3, 4. A little high. I could probably come down a little bit, but I just want to check my lateral view first. So let's do a lateral view, please. These are the hardest surgeries we do. Thoracic. Now she's laying on her belly, and my anesthesiologist is keeping her comfortable while we get into that disc to try to fix it. Watch the arm. You probably need to go a little bit towards me, maybe. I don't know.
Go a little bit, 1 inch south, and you're fine. There you go.
Shot. All right. So let's go back. Is there any way you can get me a better view? I think we're off on orbit. Yeah, shot. That's a little better. All right, I see a disc there. It looks like the T3-T4. Let's see if I can get there. And I think I was a little high, right?
Yes.
So, shot. Shot. Let's go with an AP view. We're still off on orbit. We got to fix the orbital issue. Folks, I'm going to focus on this. This is the hardest part of the surgery. Let me get focused and then I'll come back and talk more with you. But if you have questions, feel free to type them up. All right, so go more north. Shot. All right, so we have, you need to come a little bit to my side, Jordan. You're too far to your side. Try to get it right and keep it right. Okay, good. So T1, 2, 3, 4. So we are right over the T3-4 disc space. I'm just a little bit too medial. So, shot. That's looking good. And there's the facet, Coker, shot. All right, so I'm a little too medial. I need to go a little bit more lateral. I always like to start more medial, shot. So 1, 2, 3, 4. Again, we're in the right spot as far as the level. I just have to get us down to the spine. That's the hard part. Shot. Lateral. Now, she's in a surrender position, right? So I need a little bit better lateral view, Jordan. Dr. Berndes, we're going to be putting in a lateral. I need you to check the elbows and arms to make sure we're not hurting her with the fluoro. Try to shot. Try to bring it towards you, Jordan. And that's a little bit better. Shot. All right, so it's overexposed. And I think we're off a little bit on WAG. Let's see what WAG will do for us. I mean, I can see disc spaces, and it looks like we're lined up not properly with the disc space, though. Shot. It's really interesting. Jordan, let's see what we can do on WAG. I think we're off on WAG. Well, that's not WAG, that's orbit. I'm not concerned as much about orbit. I'm more concerned about WAG. Oh, I see. No, it's not really working. Let's go back north a little bit if you can. Shot. It's really hard to see the pedicles. Shot. That's a little bit better. I think we're still off on WAG a little bit. Yeah, I think that's a good idea, Jordan. All right, I think I see where we need to be. I think it's the higher one. I think it's the one up. So I need to be a little bit more north. Aiming south. Shot. Any way you can clean that up for me just a little bit? Shot. That's a little bit better. Maybe. At least we're lined up properly. I feel the facet. Shot. I mean, that looks like... Any way you can get more north, or you can't go any more north? A little bit would be nice. Now I would either drop the floor or raise the table, yeah, or change your collimator. That looks pretty darn good. I can live with that on the lateral. Now let's check an AP. So I can live with that lateral. Let's see where we are in AP. I think I'm a bit medial on AP, which is fine. Just lay still, you're doing great. So our patients are not intubated, they're awake. I want her helping me with this surgery. So there's the artificial disc, 1, 2, yeah, 3, 4. So it looks like I'm a little bit high, but we need to be a little bit lower. Let's go back to the lateral view. You can see her artificial disc. One, 2, 3, We may need to be one level down. Let's take a look. I think we might need to be one level down. So, yeah. So I need to be a little bit further south.
What happens to the range of motion when you have those discs? Is it really affected, or is it
Huh?
the range of motion?
Shot. Too low. The range of motion with the artificial disc? I don't know. Let me just focus on this for now, if you don't mind, Shot. This is going to be the hardest case of our day. Shot. Alright. I think that is... Can you see the disc in front of the needle there? I'm just wondering what we can do for orbit. I think we're still off on orbit. I don't know. Maybe go back a little bit. Shot. Yeah, that's better. Go back a little more. The facets are coming nicely together. Overlap. Shot. Yeah, so it looks like it's a little bit better. Shot. It looks like I'm lining up nicely. Am I going to get lateral enough is the real question. So I'm going right through that scar tissue from her prior surgery. Shot. 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 I need to get around the facet joint. Let's get an AP. Yeah, we're definitely off on orbit. We need to fix the orbital issue. I think her spine has some scoliosis. Too medial. Yeah, that's what I thought. But let's fix the orbital issue. Go lateral. All right, so let's see where are we at. So 1, 2, 3, 4. It's really hard to tell on the AP view. I think we have to do a little bit better on the AP view there, Jordan. We need to be able to see down the disc. Shot. She's a little kyphotic here, so you got to accommodate for the kyphosis. Alright, so we need to fix this orbital issue. I would rotate a little bit. She's not moving, right? More. Shot. What do you think? We overcorrected?
You want to do a disc event too, right?
I would like to, if possible, but I don't have to if we can't. Huh? No, you don't have to lighten her up. It's gonna, I really need to see the front of the spine. Get rid of some of the back there and fix the orbit. You see the double ribs? So try again. Other way. Go the other way. Shot. You think it's going the wrong way? Jordan? Looks like she has some osteoporosis. It looks like I'm lined up nicely with a disc. Shot. Alright, go AP again. We're coming down on a disc, and I need to know which disc it is before we get any further. It's either going to be the T3-4, it's going to be the 4-5. So there's 1, 2, 3, 4. It's really hard to tell. Give us a little more kyphosis. Shot. It's really looking like we're coming down on, so that's 1, 2, 3, 4. We're kind of right at a vertebral body, right at a pedicle. And we need to be at the disc above that pedicle. Go back to a lateral view. Lung fields look good. 1, 2, 3, 4, 5. And we're doing 3, 4. Everybody agrees. Shot. Yeah. What do you think? It just feels like we're over penetrating, right? Yeah, I think it's the disc above. Shot? So, and what else can we do? I mean, she can't have that much soft tissues, right? Shot? I think we're a little bit better, but I think we're still too low. Huh? She is a little bit slanted, but it's not that bad. Shot. We're awfully close. I just need to get around this facet joint, and I think we're going to be there. Shot. I just feel like I'm too medial. AP. Let's see where we are. I think we're lined up with the proper disc. What I need to do now is just probably be slightly bit more lateral on my entry and my trajectory. Oh, we're just almost there. So let's see. 1, 2, 3. So 1, 2, 3, 4. Give me a little more. Shot. I don't know about that. Go the other direction. Shot. What do you think? Worse, right? Is it worse or is it better? That's the real question. Yeah, it looks a little worse. Go back to where you were. See what happens, folks? As you rotate, it shifts the position of the needle. Go a little more. Shot. All right. So 1, 2, 3, 4. It looks like we're between 3 and 4 pedicles. You agree? Yes, sir. All right, let's go back to a lateral. It's very hard to see on the lateral. But it looks like we're between the 2 pedicles. I think we need to be slightly further south. Not easy, folks. Not easy. This is very hard to do. We're trying to take our time and do it right. Can you watch the arms, please? Shot. Okay. Boy, what a different view on the lateral, huh? I mean, the lateral, it looks like we're lining up nicely. On the AP, it's not as nice. I need to see those pedicles better. Yeah, I'm not sure it's an orbital issue. I think it's a wag. Let me wag it. Release it. Shot. Oops, don't release the orbit. Shot. Orbit is off. Still off. Give me more. Again. No, it's off worse. Go the other direction. Stop. Shot. A little more. It's really hard to tell. Damn. Alright, let's hold the orbit where it is. I can't tell. Shot. trying to get the pedicles to line up, folks. Shot. It won't go any further north. Any way you can move the arm boards more north? That's the maximum? You guys have the boards and the arms as far north as possible? You have them dropped as much as possible?
Let me see here.
Do you see what I mean? Like, if you're like this, I don't want that. I want it like this. Okay, every time we do a thoracic, you've got to put the arm boards at the most north, with the elbows at the most north, and dropped as much. Because if we haven't done that, then it hurts our ability to see what we're doing.
Okay, so I got room here. I got like about this much room on each elbow. Just so you know. Yes, come on up. Come on up. Keep coming.
Just the slightest amount. I just need like an inch at most. That's enough. All right. That's better. It looks like we're just a little bit south of where we need to be. And what did the AP showed we were a little bit south, right? So 1, 2, 3, 4. 1, that's the last one. 1, 2, 3, 4. We could be down just the slightest amount. I think we're in the right place. I just need to get us a little further south on her. Shot. That's the disc there. Shot. AP. I think the AP's off on WAG. That's the problem. That's what's hurting us. Let's try to fix the WAG on the AP. Shot. It's too rotated. Shot. Yeah, we're too medial. I think we need to go a little bit more lateral and a little bit more inferior. 1, 2, 3, 4. Yeah. Okay. Shot. Not bad. How is she? Stable?
Yeah.
Shot. That's awfully close to where we need to be. Shot. Lateral. 1, 2, 3, 4. We're at the right disc at least. 1, 2, 3, 4. You got a nice spinous process position on 3 and 4. I'm happy with the AP view. We just need to get the lateral view corrected. And it looks like my side's further north. That's the problem on the WAG. Your side is further north. That's the problem. You got to get my side further north. Bring the base south and move my side further north. I think we're wagged off the wrong direction. That's why. Bring the base further south. Shot. So folks, what we're trying to do is accommodate for her scoliosis. She has some scoliosis. And move my side further north. We're almost there. It's almost there. Shot. And that's the best we can do. Let's see if we can make it happen. We're very close. Shot. Almost there. I could be just a millimeter. Oh, there it is. Shot. Let's see if this works. You have to be careful, people with osteoporosis. Shot. All right, we're there. Let's just verify the AP view one more time. Whew. Let's see if we can make this happen. We're so close. We're right at the back of that disc. You can see the disc is not normal. on the x-ray. This poor woman has been through so much. Yeah, that looks good. So 1, 2, 3, 4. Everybody agree 3, 4? I think it's 3, 4. It's perfect. That's perfect. Henry, you getting all these x-rays?
Of course, yes.
Lateral view. All right, I think we're where we need to be. We're at the right level. T3-4, right side. We're on the right side. We're at the right level. And I feel like the needle is in perfect position, as good as we're going to get it. Like, it's not perfect. I mean, there's certainly could be a lot better than this. It's very, very difficult. But it's as good as we're going to get on her. Yeah, we finally got the wag thing figured out because we were wagging the wrong way. And what I did is I looked at her scoliosis to figure that out. There we go. Perfect. We're in. All right. Perfect. Now, you think she can give us a response or no? And it's okay if she cannot. No?
I'll check. Hello? How are you doing? You okay? Yes, she's okay.
Oh, wonderful. Are you having any pain? Ask her if she's having any pain.
You having any pain in your upper back? Don't move your arms, please.
Yeah, lay still.
Move your arms really still.
We're almost done. We're going to put you to sleep. We'll be done.
You having any pain in your upper back?
All right, give me a marker.
Right now?
Is she reliable? So guys and gals, you could see the surgery she had before at the Rothman didn't work. She has a herniated disc at T3-4.
All right.
We're finally inside the disc, and I want to verify. Is she responsive?
Hello? How you doing? You all right?
All right, let's see if she has a pain response. Shot, and we're going to use the cervical, right? Take this. A lot of scar tissue, I can already tell. A lot of scar tissue. Won't go in. Shot. Will not go in. Hold on. I'm going to try one more time. Shot. Sometimes if you just get away from the scar tissue, you can get it. There it is. Shot. Perfect. So it's leaking out. She's still sleepy? Okay. Well, it's leaking out from the disc through the tear in the back of the disc. We're going to go fix her disc. Shot. This poor woman has been through so much. And, yeah, it's good. It's good.
Yep.
We're going to do our incision. You ready? This is a 4mm incision. I will take questions at this point, okay? Once again, she's had this pain for how many years? 5 years. She said it interferes with every aspect of her life. Her work, her social life, her family life. Shot. And it's debilitating. So debilitating, she's even had surgery for it. Surgery that was never going to work, taking her muscle out of her spine. And I would never recommend that surgery. We believe in going to the source. Shot. The source in her case is her disc, T3-4. Raytech. So, any questions? If not, let's go ahead and show the audience a nice video on how disc injuries actually cause back pain.
We do have quite a few questions. Do you want me to proceed with the video?
Raytech? I got sticky fingers. I need some irrigation. No, I'll take, yeah, let's proceed with the video first.
Copy.
Okay, welcome back. You can see from our video, that the reason people get so much pain from a disc injury is really due to what's called inflammation. And inflammation is your body attacking something, trying to repair it. Inflammation has been around for a long time. And in reality, your body can't fix these tears. It tries, but it can't. So people suffer with pain. Now, I just went through the area of her surgery. There's a lot of scar tissue. I could feel it from her prior surgery. That surgery was done at Rothman, and it didn't work to fix her pain, but they were treating her muscle spasms related to the disc. Yeah, there's all scar tissue right there. So we'll start taking some questions. Shot?
First question comes from Mitsuri on YouTube. And they asked, so was her previous doctor unaware of this surgery she didn't need? Why put her through that?
Yeah, so people are desperate when they're in pain. They'll do anything. And the other doctor that did her surgery didn't know what else to do. And she kept complaining about a muscle spasm. Well, the muscle spasms that you get along your spine are always from a disc problem or a facet problem. And so if you fix the disc problem, you fix the muscle spasms. You know, it's kind of like if you have a house that's burning. It's burning down to the ground. And you see smoke, you see fire, you see smoke. And the smoke is always from the fire. If you put out the fire, the smoke goes away. But blowing the smoke away is never going to fix the fire. And the fire is going to keep destroying the house. So the same thing with the spine. When you have muscle spasms, it's always like the smoke. It's not the primary problem, it's the fire that's the problem. And when you have muscle spasms, it's always the spine that's the problem. So the joints in the spine. So in her case, the problem is the disc. And she told me that the surgeon said he just couldn't fix the disc. There's nothing he could do. So he cut the muscle out from her spine instead. It's the wrong thing to do. There's no doubt about it. It's like blowing smoke in a fire to get rid of the smoke when you have to really put out the fire. I don't condone what her surgeon did. I would never support it. I think it was a mistake. But, you know, there's a lot of surgeons out there recommending bad surgery to their patients. That's kind of why we do this broadcast, is to make people aware of that. The surgeon will never tell the patient, I'm going to do a bad surgery on you. The patient needs to become more aware of what's good and what's bad and their choices. And that's why we have this educational broadcast, is to so hopefully we could teach people the truth before they go and do things they shouldn't do. She's from Philadelphia, and I think Philadelphia, she's from Pittsburgh, right? I don't know I think it's Philadelphia. Huh? No. Is it? I thought she was Philly, right? We have another patient from Tennessee. I think the next patient's Tennessee. So the last patient we had, weren't they from Alaska? The last lady I think is Tennessee. Right? The cervical? Anyway, I'm getting my states confused. Point is, I think the surgeon just didn't really have any other option.
Memphis, Tennessee.
This one's Memphis? All right. I don't know why. I think the next one is Philadelphia then. Why would she go to Rothman? They don't have a Rothman in Tennessee, do they? Maybe they do. All right, next question.
Next question from Rick on Facebook. Rick asking, what surgery are you performing?
Rick, we are performing an endoscopic, that's why you're able to see through a little camera and tube, endoscopic Deuk, spelled D-E-U-K, laser disc repair. And by the way, the laser is that little glass fiber you see at 12 o'clock. It's hard to see. I just moved it a little bit. And the laser is removing the herniation, the scar tissue, the inflammatory tissue from the tear in the back of this T3-4 disc. So we're doing a thoracic T3-4 Deuk laser disc repair. And we're treating thoracic pain, aka dorsalgia. Look at that herniation right there. You see the blue thing? That is the herniation stuck
Yes, we do.
in the tear. And here it comes. It just came up and out the tube. Almost done. I got maximum 10 minutes, doctor. Let's just say 10 minutes. I think 10 minutes is a fair number. Flip. So I'm going to go back and forth. I'm going to get both sides of the herniation, the part that's towards the middle and the part that's towards the outside. This is all herniation right here. You see the gold color? That is calcium found within the herniation. So people talk about calcified disc herniations. Calcification of a disc herniation or calcified disc herniations, they don't just happen overnight. They actually happen a little bit at a time. And you're seeing that right there. That gold color is the body's response. So when your body does inflammation against something for a long time, there's so much tissue damage from your body attacking. Look at the pink. You guys see the pink? That's the
Yes, we do.
inflammatory granulation tissue. That's where the pain comes from. So there's a herniation right there, the blue thing, coming out of the tear. That's what we're doing. We're doing a debridement of the annular tear. It's called an annular debridement. It is discovered here by me at Deuk Spine. I was the first to do it in the world 18 years ago. And we've been doing it for 18 years and 2,000 patients now, almost 2,000. This month we'll hit 2,000 patients. This is March 2024. So point is, we want to remove as much herniation in this area as we can. We want to clean the tear so that it will heal itself, because it will heal itself when you get rid of the blue herniation. And you want to get rid of that pink stuff right there, because that's the source of all the pain. It's inflammation. If you've ever had a pimple on your face, oh shit, you know it's red. Sorry about the poor view. I think I got some liquid or something. I may have a fiber optic issue. Keep the questions coming, by the way. You know what? Before you do that, have you shown them? No, go ahead. Have you shown them the video on how the Deuk laser disc repair works?
Not yet, no.
Let's do that. I'm going to show you guys for the lumbar because we don't have a thoracic one, but we will eventually. All right, I apologize. Let me get this working again. All right, what'd you guys think about the video? I would check the scope first, Luis.
Yeah, no.
This one definitely looks better, but I was torquing on it quite a bit. By the way, scope use would be kaput. As some of our patients say, 20 out of 10. right? All right. Sorry, go ahead with the questions, Henry.
Yes. Next one comes from Bo on Facebook,
Hi, Bo.
asking, do I need to call the institution to get set up with another MRI with Dr. Deuk?
Bo. I don't know. I'm Dr. Deuk, and I don't know who you are, but the way to get an MRI review is to fill out our form online on our website. We have a website called DeukSpine.com, and if you go there, there's actually a page called MRI.DeukSpine.com. If you go to that page, you fill out the questionnaire, well, where's your pain, etc., and it'll take you about 10 minutes, and then you send us by UPS, FedEx, whatever. You send oh yeah, look at that herniation. You send us your MRI. Now some people have, login credentials for their server for the MRI center, So you got to send us either your link with your login credentials so we can pull up your MRI, or send it on CD, or upload it on our website. We prefer you to upload it on the website. I think that's probably the easiest. But if you want to send it by CD, feel free to do it that way. Just remember, we don't send it back. We're not going to pay for sending it back to you. The MRI review is already free. So anyway, if you want it sent back, send us an envelope with self-address, postage, etc., and then we'll send it back to you when we're done.
Oh, he's asking if can he set it up, make the appointment. I think he meaning you.
I don't know what appointment he's talking about, but
I think just the MRI review.
yeah,
like,
just put the link.
Yeah, I heard
for
it. Yeah.
You know what? You know what we need, Henry? Geez, this is a great day today. We need a video that you can run during the surgery on how to do the MRI review.
Copy that.
How awesome would that be?
Yeah.
Like a little, 1 minute educational video. It shows somebody sitting at a desk, computer, then they go to the web page and they click on free MRI review, then they start to fill out the form, and then it shows them putting their CD in an envelope and mailing it to us. Okay?
That I would be down to do that. That will take time, but that can be done.
Yeah, you and Sam and Isip can do it, but I suggest you guys do it maybe next week or later this week if you have time.
This week I'm trying to prioritize working with the animation, so it may not be this
Yeah,
week or
that's fine. No
so
problem.
I'll do what I can and talk with Sam about it
Thank
though.
you. Yeah, that works for me.
Okay.
But I think we need a little one that we can run during the surgeries to show people how to submit their MRI. Because we get this question a lot, And I was just thinking it'd be nice to show people. Just about done. 2 minutes. We're almost finished with this disc. Again, T3-4. And I believe this procedure will take her pain away, this disc pain, and fix her problem. That's what we're expecting. We've done now about 26 thoracic disc surgeries like this, 26, and our success is 99% of the pain gone. The key is to get the right disc. You got to fix the right disc. So in some patients, it's kind of hard to tell which disc is the right disc. And some people have more than one disc. That's the cause. So you got to get all the discs that are causing pain. If you don't, the patient will still have pain. All right, just about done. There's the end of the disc right there. Let's see, anything else? I don't see anything else. All right. Pretty cool stuff. 30 seconds. And we are done. Wait, come on. You don't stop until I take the laser out. All right. Now you stop.
Hitting on, please. Thank you.
You got a hot date or something there? Nikki? A little anxious to get done with the laser there, huh? All right, what other questions do you have? Why don't you guys type them up? I'll come answer them for you face to face. Point is, we got in, we got it done. T3-T4, and I feel real good about it. Unfortunately, this poor patient had so much pain that she lived with for a long time before we could fix her. And some other surgeon got to her and cut her muscles out of her spine. Literally from here to here is the cut. And I can feel the muscles gone. You want me to staple this or you got it?
No, I got it.
All right. So we're going to, you guys see the incision? All done with a 4mm incision. Right there. You guys see that?
Yes, we do.
You can turn off the cell phones.
So,
Thank you.
endoscopic, minimally invasive, beautiful surgery, if it works. If it doesn't, she'll be the first one it didn't work for. It's worked for all other 25 patients we did thoracic, and I'll come answer your questions face to face. So type them up. Thanks everybody, good job. We got one more to go. A lady with a herniated disc, L5S1, right side, can't even stand, can't even walk. She's been in a wheelchair because she's in so much pain, and we're going to go do it endoscopically. Good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled as far from Austin, Texas. He came to Florida to Deuk Spine Institute because he had a problem with his thoracic spine. He's had pain in his thoracic spine, and I'm gonna let him tell you a little bit more about it. But I can tell you one thing, he just had surgery yesterday, the Deuk laser disc repair. How are you feeling today?
I feel amazing. The relief is incredible. It's more than I imagined.
And you were saying outside you were on the verge of crying, or you were crying yesterday because of the pain relief. Tell us about that.
It was really weird. Liz asked me what I wanted to do. I just burst out. Couldn't stop myself. It's just so amazing to have the relief. It's incredible. I never thought it would come. I've been looking for this for so long. It's been a very, very long journey to find you.
39 years, right?
35, yeah.
35
years.
Tell us about that 35 years of suffering you've gone through.
It started with lumbar cramping, muscles seizing to guard the injury that I couldn't even find. I went to countless chiropractors, neurologists, neuromuscular therapists. They took MRIs of my lumbar and said my back was great and that they couldn't help me. They had no idea why my back hurt. Finally, 5 years ago, somebody took an MRI of my thoracic, found 4 herniated discs and said, well, there's nothing we can do. Maybe in 20 years we can fuse all your vertebrae and that's it. I just wasn't willing to accept that. So I just kept looking and I found a video of you talking with one of your patients about a thoracic disc injury that you fixed. And so I called, and it was the best thing I ever did.
And then you drove here.
We flew in, but
flew here.
It was a long trip. I'm from Austin, Texas. And I looked everywhere. I was like, well, if he's doing it, somebody nearby is doing it. No, nobody is doing this but you.
That's right. We're the first in the world.
We have to fix that.
we Deuk Spine pioneered the thoracic transforaminal endoscopic Deuk laser disc repair, which is what you had done yesterday on your thoracic disc. And how do you feel today? Are you having any of that pain?
None of it. It's all gone. I had referred pain near my piriformis. I had referred pain in my heel. It's all gone in a day. I was having muscle cramping up my entire back between my shoulder blades. It was giving me headaches, and it's all gone.
How did the pain affect your life?
It was terrible. I couldn't sleep. I couldn't sit for very long. I couldn't stand for more than 5 minutes without shifting or moving. It made driving difficult. Everything, and it was going downhill. It was continually getting worse and worse. Flying on a plane was difficult just because I had to sit still for so long.
And your wife, she was worried about you all the time because you're suffering. I mean, and it's hard to do anything enjoyable together, hiking, walking, canoeing.
Yeah, I really couldn't do much of any of that. Everything was very short term because the pain would just get overwhelming.
And you're from Austin. Austin's a wonderful city.
Yeah, we have a lot of
There's so
outdoor
much
things to do.
Yeah. And so how did your pain affect your ability to
enjoy nature and Austin and everything it had to offer.
We stopped going out. We literally just confined ourselves to the house, and it was all my fault. And I felt so bad for my wife, and I was tearing up our relationship because of it.
And this is what I'm talking about when I say relationship, is people with chronic pain, they don't just miss out themselves on life, but their loved ones miss out too. Because if he can't do anything enjoyable outside because his back hurts too much, well, then she can't really either, because she's going to be by his side. When you're by the side of your spouse, that means you're suffering every moment they are. So this is a new chapter in your life that you're going to open because you guys came to Deuk Spine.
Yep, I'm so excited. I'm so excited. This is
excited
amazing.
For you. And you can see actually in the surgery, we went in with a tiny little cut on his back, a couple of them, and we went into the discs and we repaired them using the laser.
All right, sorry to take you away from that wonderful testimonial of a patient who traveled actually from Australia for thoracic TLDR. But this patient here traveled from Tennessee. I got her mixed up with a patient from Pittsburgh who's, I think, next. Anyway, that said, surgery went well. It wasn't easy getting in. Let me show you what we did so you can understand how we got there. This is the spine. She had 2 artificial discs in her neck, 5, 6, 6, 7, and the problem now was actually a herniation in the thoracic spine, right there, okay? So this is how I got there. Bam. You guys see that?
Yes.
So here's the back. In the middle of the back, I went from the side, and I went through that hole right there, and I used the laser to repair the herniation there. Okay, it's called transforaminal. Not an easy thing to do. She didn't make it easy for me, and the surgeon that he went in there and cut the muscle off of her spine. Wow. I think now I've seen it all.
Yeah.
I mean, I've never seen that before. I've never seen a surgeon cut muscle out of a patient because they had muscle spasms. That's a first in 26 years, and hopefully a last. I've never seen that. Anyway, obviously it didn't work. She's back. We just fixed her. I think she's going to do great. Questions?
Questions. First one comes from JMC on YouTube,
Hi, JMC.
asking, I have a lumbar fusion from L3 through L5 with left L5 screw fracture. Is it worth having a reoperation? I have pain in the right hip.
Yeah, first of all, the best advice I can give you is let Deuk Spine Institute evaluate your pain, figure out where it's coming from. If the pain's coming from your hip joint, then you need your hip joint addressed, and we can do that. If the pain's coming from something else like your SI joint, piriformis muscle, facet, broken screw, we'll figure it out. It takes literally 5 minutes for me to figure it out through a Zoom call. So fill out the form, and I'll see you on Zoom.
Next 2 questions. First one coming from AAKK on YouTube.
AAKK, sure. A lot of
Asking-
questions.
What
Good
ma-
questions.
Yes, of course. What makes the thoracic disc DLDR more technically difficult than lumbar/cervical? Is it because you have to be more protective of the spinal cord? What measures do you take in order to accomplish this?
Yeah, so great question. That's an hour-long talk. The thoracic is the hardest. It's got the ribs there, which add barrier to entry. It's got the lung, so if you deviate too much laterally or anteriorly, you get the lung. You got the spinal cord medially. You got the epidural veins and nerves coming out of the hole. There's a lot that can go wrong. So that's why I need the patient awake to help guide me, and she was awake enough to help guide me. But the key is to get in that small space. It's a sub-millimeter space sometimes. And if you notice the tip of the needle, I don't have one here, but it's beveled, meaning it's very, very thin. So if I get it perfect, then the rest of the needle slips in and can kind of push things away. So that's what we did, and the surgery went perfect. Yeah, thoracic is just the hardest. That's why nobody does it but us. Ron, don't go anywhere.
And then last but not least from Royal ViewTube on YouTube asking, Doc, what are the symptoms from a T3-T4 herniation?
Yeah, the symptoms are always going to be pain, dorsalgia they call it. It's basically pain right in the center of your spine. It could be a little to the right, a little left, a little on both sides. And then you can get a radiculopathy where the herniation irritates the nerve root that runs along the rib, and then that pain will radiate around your ribs, either left or right or both. So you can get thoracic pain in the middle of your spine, called dorsalgia, and then you can get radicular pain called intercostal neuralgia is right. That's what it's called. And this procedure fixes both.
And that is it.
Thanks for joining us. We have one more surgery, L5S1, herniated disc for back pain and sciatica and radiculum.